Heavy periods or menorrhagia. Heavy periods, also known as menorrhagia, refer to menstrual periods in women that are excessively heavy, prolonged, or both. This is a common gynecological problem that affects many women and can have a significant impact on their quality of life. The definition of heavy periods may vary from woman to woman, but it is generally considered to be when a woman loses more than 80 milliliters of blood during a menstrual cycle, or when a period lasts longer than 7 days. Some of the common symptoms of heavy periods include soaking through pads or tampons in an hour, needing to change protection during the night, passing blood clots, and experiencing fatigue or weakness due to blood loss. What causes heavy periods? There are several potential causes of heavy periods, which can vary from woman to woman. Here are some of the most common causes. Hormonal imbalances. Changes in hormone levels can cause heavy periods, particularly during puberty, perimenopause, and menopause. Imbalances in estrogen and progesterone can disrupt the normal menstrual cycle and lead to heavy bleeding. Uterine fibroids. These are non-cancerous growths that develop in the uterus and can cause heavy menstrual bleeding, pelvic pain, and other symptoms. Adenomyosis. This condition occurs when the tissue that normally lines the uterus begins to grow into the uterine walls, leading to heavy bleeding and pelvic pain. Endometrial polyps. These are growths that develop on the lining of the uterus and can cause heavy bleeding and irregular periods. Endometriosis. This condition occurs when the tissue that lines the uterus grows outside of the uterus, leading to heavy bleeding, pelvic pain, and infertility. Blood clotting disorders. Certain blood clotting disorders, such as von Willebrand disease and platelet dysfunction, can lead to heavy periods. Medications. Certain medications, such as blood thinners and nonsteroidal anti-inflammatory drugs, NSAIDs, can cause heavy bleeding as a side effect. Other medical conditions. Certain medical conditions, such as thyroid disorders, liver disease, and pelvic inflammatory disease, PID, can cause heavy bleeding. Cancer. In rare cases, heavy bleeding can be a sign of cancer, such as cervical or endometrial cancer. Menorrhagia, or heavy periods, can cause a range of symptoms that can vary from woman to woman. And some of the most common symptoms of menorrhagia are heavy bleeding. This is the primary symptom of menorrhagia. Women with menorrhagia typically experience bleeding that is significantly heavier than normal, and may soak through a pad or tampon in an hour or less. Some women may need to change their pad or tampon during the night. Prolonged bleeding. Women with menorrhagia may also experience periods that last longer than normal, typically lasting more than 7 days. Passing blood clots. Blood clots are a common symptom of menorrhagia. Women may pass clots that are larger than a quarter or experience a gushing of blood. Anemia. Heavy periods can cause iron deficiency anemia, which can lead to fatigue, weakness, and shortness of breath. Pain. Women with menorrhagia may experience cramps, pelvic pain, or lower back pain. Disruption of daily activities. Menorrhagia can interfere with a woman's daily activities, including work, social activities, and exercise. If you are experiencing heavy periods or menorrhagia, there are a few things you can do at home to manage your symptoms before seeking medical attention like 1. Stay hydrated. It is important to stay hydrated by drinking plenty of water and other fluids. This can help prevent dehydration and reduce the risk of anemia. 2. Rest. Resting and avoiding strenuous physical activity can help reduce heavy bleeding and relieve cramps. 3. Apply heat. Applying heat to the lower abdomen, such as using a heating pad or taking a warm bath, can help reduce pain and discomfort associated with menstrual cramps. 4. Over-the-counter pain relievers. Over-the-counter pain relievers, such as ibuprofen or naproxen, can help relieve pain and reduce bleeding. 5. Use sanitary pads or tampons. Using sanitary pads or tampons can help manage heavy bleeding and prevent leaks. These home remedies may help manage symptoms temporarily, but they are not a substitute for medical treatment. If you are experiencing heavy periods or menorrhagia, you should visit quickly your doctor. Moreover, if you are experiencing any of the following symptoms: heavy bleeding. If a woman is experiencing heavy bleeding, soaking through a pad or tampon in an hour or less, or having to change their pad or tampon during the night, they should speak with their healthcare provider. Prolonged bleeding. If a woman's period lasts longer than 7 days, they should speak with their healthcare provider. Passing blood clots. If a woman is passing blood clots that are larger than a quarter, they should speak with their healthcare provider. Anemia symptoms. If a woman is experiencing symptoms of anemia, such as fatigue, weakness, or shortness of breath, they should speak with their healthcare provider. Disruption of daily activities. If a woman's heavy periods are interfering with their daily activities, including work, social activities, and exercise, they should speak with their healthcare provider. There are several treatment options for heavy periods, or menorrhagia. The most appropriate treatment will depend on the underlying cause of the heavy bleeding, as well as the woman's age, medical history, and overall health. Heavy periods are menorrhagia medications. Some of the most common treatment options for menorrhagia include 1. Hormonal therapies, such as birth control pills, hormonal IUDs, and hormonal patches or injections, can help regulate the menstrual cycle and reduce heavy bleeding. They work by reducing the amount of estrogen in the body, which can help decrease the thickness of the uterine lining and reduce bleeding. 2. Non-hormonal medications, such as nonsteroidal anti-inflammatory drugs, can help reduce heavy bleeding and relieve pain associated with menstrual cramps. 3. Tranexamic acid. Tranexamic acid is a medication that helps to prevent blood clots from breaking down, which can help reduce heavy bleeding during menstruation. 4. Surgical procedures. In some cases, surgical procedures may be necessary to treat menorrhagia. Examples include endometrial ablation, which involves removing the lining of the uterus, and hysterectomy, which involves the removal of the uterus. 5. Other treatments may include dietary changes, such as increasing iron intake to prevent anemia, or lifestyle changes, such as reducing stress or increasing physical activity. Treatment for menorrhagia can help reduce symptoms and improve a woman's quality of life. It is important for women to speak with their healthcare provider to determine the cause of their heavy periods, as they could be a sign of a serious underlying condition that requires medication, and find the best treatment option for them.